Hello guys, now we shall be discussing about herpes simplex virus encephalitis. So now we shall be quickly revising about herpes simplex virus encephalitis. Now in this herpes simplex virus encephalitis, obviously even this is also caused by herpes simplex virus 1. Okay, herpes simplex virus encephalitis is caused by herpes simplex virus 1. Now, another important thing you need to know is that how is this getting transmitted and to what all areas will it get transmitted. So, let me draw a picture. Right. All of you know that here we have got the anterior cranial fossa, right? We have got the middle cranial fossa and we have got the posterior cranial fossa, and this is foramen magnum. Okay. Now, here we have got the lobes of the brain, right? So, this is the brain cavity, for example. This is the brain. Okay. Now, another important thing is that let us say that we have got a small nerve that is running, and moreover we have got some openings here. These openings of the anterior cranial fossa here near the ethmoid bone, right? These openings are called as cribriform plate, right? There are minute holes there. So what will happen is that from the nose we have got a nerve that is going up. This is called as olfactory nerve. Now this olfactory nerve passes through this cribriform plate, enters into the brain. Clear? Now look here. Important thing. What is the important thing? The important thing is that this HSV virus, herpes simplex virus 1, first and by the way, all of you know, I forgot to tell you that we have got something called as oropharynx, right? We have got this thing called as nasopharynx. Nasopharynx and oropharynx together they join and form laryngopharynx. So now look here, this herpes simplex virus resides in the oropharynx. Okay. Now from the oropharynx, obviously it will reside in the trigeminal ganglia, I told you, but if it is to cause this encephalitis, so from the oropharynx, it would first enter into the olfactory tract. Now from the olfactory tract, the virus will ascend up and enter into the brain. Now from in the brain, this virus will move towards the temporal lobe. Okay, so what is this lobe here? This is called as your temporal lobe. Temporal lobe. And when it will reside in the temporal lobe, it will cause infection of the temporal lobe. This is called as necrosis. It will completely damage the temporal lobe. It would cause hemorrhagic necrosis. Hemorrhagic necrosis of your temporal lobe. Okay. So what is happening here? What is happening is HSV1. First it enters into your oropharynx, and from the oropharynx it would move to the olfactory tract. From the olfactory tract it would move to the temporal lobe. And in the temporal lobe, this is gonna cause hemorrhagic necrosis. Okay. So what will be the symptoms here? What will be the symptoms are patient would have acute fever. Patient would have acute fever, and not only acute fever, patient would also have headache. Acute fever, headache, seizures, and as it is affecting the temporal lobe, patient's speech will be impaired. That would be aphasia. So these are the important things, right? So as this infection is infecting the brain, right, it would also infect the CSF. So the gold standard would be you take a sample of CSF and do a test called as PCR test. So in the PCR test you would find it. You would find the DNA of this virus. Okay. So this would be the definitive diagnosis. This would be the definitive diagnosis. So this is all you need to know regarding the topic HSV encephalitis, guys. So thank you so much for watching my lecture. Goodbye.